morning, everybody. Thank you for coming. It's a pleasure to be here. And I'd like to introduce the star of today's show, Susanna, who's been kind enough to come in today. And we've discussed her medical history, and we're ready for takeoff. Everything is A-OK. What I'd like to do is go through what I see, and we're going to be looking at the left side of her face. I'm going to start with the upper third of her face, and she happens to have a pretty full temporal area, which is wonderful. So she doesn't need any filler here. Looking at her brow, we could see a pretty profound asymmetry between her brows, and what we're going to try to do is get a little elevation over here. Moving towards the glabella complex, we could see she does frown a bit. She's at the earliest stages, but again, at this point, Botox Vistibel would be wonderful to help prevent her from getting the lines. Now, moving down to the middle third of her face, she has a little concavity in her earlobe. This is an area which we often forget about, and it would be nice just to address that. She has a pretty full zygoma area, but we can put just a little, just to start lifting a bit. And where she has the greatest loss is both in the malar region, and that can be impacting on the tear trough. And what we're going to try to do is address this malar region, and by doing so, try to improve the tear trough, and then see if we have to go on a bit more. The upper nasolabial fold is pretty full, so she won't need anything in here. Moving down to the lower third of the face, we could see that in the angle, the oral commissure, she does have a little drooping, and that's making her look just a little sad, and she's a very happy person, so it would be wonderful to try to address that. And then moving into the jawline, we could see there has been a little volume loss in this area. And I had happened to ask her just if she has any alterations in her calcium, and she wasn't sure of that. So I asked her to address that, because when I see so much of a change in the mandibular region when their rest is pretty full, so then I start thinking that she may have a bit of bone resorption, and that would be at least something that she could start supplementing. So now let's take a look at the anatomy. In the upper forehead, I have drawn here the frontalis muscle, and I do that because I try to emphasize that in the lateral corrugator, here's the corrugator, running from a very superficial location into the deep medial aspect, deep muscle of procerus, that in classic textbooks, it talks about 1 centimeter above the brow, above the orbital rim. And the reason they did that originally was because concern of diffusion of material to this little marked area, which is a levator palpebral muscle. And if you get that, you're going to get a droop. So because of that, they said go 1 centimeter above. In doing so, and this is why we had the frontalis here, it interdigitates with the corrugator, and often when you hit the frontalis, there will be a little droop. So what we want to do, we're going to have a different approach where we're going to be going more in the inferior part of the corrugator, but extremely superficially. Okay. And just to show over here, if we were going to inject the temporalis area, we would come in from here, and either it would be a very superficial to avoid the temporal artery, or extremely deep down to bone. Okay. Now, moving over to the midface, again, this is going to be the area where we're going to inject in the earlobe. And what I like to do is draw, it looks a little complicated, but let's first get out of the danger areas, which would be the facial artery. That's why drawing a line from the medial canthus down, you want to avoid anything medial to that. And we have our infraorbital foramen here, which we would like to avoid. Now this triangle here is to help us. First of all, when we draw a line from the nasolabial fold to the tragus, what we're able to see, this line here represents anything below, we want to be superficial, anything above, we want to be more deep. If you draw another line to the lateral canthus and back down, bisect it, and draw a line from the the superior part of the nasolalia across, this is going to be the point of the maximal reflection, and so that's where we want to inject. Going medial would be our malar area where we're going to want to inject, and again this will be a deep injection, and by addressing the malar area we will hopefully start improving the tear trough. And if you notice, we start from the top and we work our way down, because when you're able to start improving, reflating these areas, you will have a positive effect even on the jaw. So that's why first, if there is any reason to inject the temporalis, and then we start out in the zygoma area, malar, because that will have a positive effect. That's why we start from the top down. And also mentioning about, again, this line, above, deep, below, superior, superficial. The only exceptions would be in the nasolabial fold superior, we're going to want to be deep. In the chin, we're going to want to be deep. And in the prejaw sulcus, along the jawline, we're going to want to be deep. Okay, and one last point about working from the top down. There is also another exception when we're dealing in the lower mid-third of the face, then lower third of the face, and we want to start from the jawline and work our way up. Okay, so now that we've done some of the anatomy, we'll be able to start with the injections. I'm going to start with the Botox. I reconstitute the Botox with 1.25 cc's of bacteriostatic saline, and I'm going to just show my first injection point, which is the procerus. The reason we start with the procerus is there is some suggestion that by doing so, we will be able to make the subsequent treatment a bit less painful, okay? And this is getting as a deep, slow 4 units of Botox. Come out, little pressure, okay. Now for my lateral one, I find where I feel that the lateral corrugator ends. And here my point is that I am, what we're doing is we're putting in a like a bleb. I use here 2 units, and I'm pointing in the direction. It's not just how much you inject or the level, but also the orientation. So we have 2 units, very superficial as a bleb. That takes care of the lateral corrugator. I'm just going to come around and finish off here with the medial corrugator. And this is going to be a deep injection. I'm protecting with my lifting up. And we are slowly injecting into the medial corrugator. Okay. And thank you. Okay. Normally, I would ask the patient to frown a bit, and that might concentrate the material in the muscle. Okay. Now, we're going to inject into the lateral brow. First, I find it helpful to prime the needle, okay? And now in this area, first question is, are we injecting superficial or deep? Are we concerned about blood vessels? Not so much. It's never a bad idea to aspirate, but we can inject superficial or deep here. Again, going into the brow, a little below, and slow injection. Okay, this is more of an antegrade. Antegrade filling is better for filling, and retrograde is really better for safety. Okay, we have put in 0.1 cc's. Okay, thank you. And just try to massage this up a little. I'm going to just do a little more. Okay, thank you. Moving, when you're injecting the brow, what you want to do is, thank you, what you want to do is be careful when you're getting close to the mid-pupillary area. Then we have the supratrochlear arteries, and we want to be careful about that. So you really want to know where you are. Okay. Okay, we're just, okay. Very well, okay. How are you doing? You okay? Okay, all righty. You could always squeeze a little ball you have. Okay, very good. All righty, now that I still have my Volbella, which is a wonderful new product, which has the famed Vicros technology. Okay, I'm just going to turn you a bit, and we're just going to appreciate the concavity here, and what this does is it not only makes the earrings sit nicer, but it is visually apparent. And just put a little more. Okay. Okay. All righty. Okay. Okay. Very good. Okay, now we're going to go over to the to just put some Voluma. Voluma is a wonderful product. Again, has a Vicros technology, smooth, lasts approximately a year and a half, if not longer. And again, thank you. Okay, and again, prime the needle. Find that point, which is approximately over here. Okay, go in slowly. And here, this is a deep injection. Remember, above the line, we're going in deep. Okay. Looks very nice. And now we're going into the malar region. And again, this is going to be a deep injection. And I'm actually going a bit below, a little inferior to where I want to end up. Go in deep, I lift, aspirate, and now inject. Okay, that now I'd like to do just a gentle massage to try to connect those two injection points. Okay, and we can see that the tear trough has improved. I think it's important to stop the bleeding because what we see is what's on the skin, underneath the skin. It's also happening. So, okay, now what I'd like to do is address the tear trough just to try to improve it. With the tear trough, we're not shooting for 100% because there's sometimes swelling. It lasts for a very, very long time. So an improvement, although it is already better with the voluma that already filled the malar area. I'm going to now use some Volbella, and there are a few few points here where the tear trough. We could see on this side again where the tear trough is, and that's in the white, where that white point is. Below that, those green points, those green dots, is where I'm going to do the injections. Okay? Okay, can I just... Sure. Mm-hmm. Okay. Little Volbella. Okay, so the points in the tear trough, I'd like to not inject directly into the tear trough. I'm going to inject a bit below, and I'm going to be on bone. Okay? And very, very slow. Just, thank you. Okay. Again, below, on the bone, gentle. And instead of a number of injection points, it's less traumatic, just one or two, and then a gentle massage into place. So we could already see what that has done. Okay, and always touch that up, but again, it's best to try to get, I'll have the voluma please. It's best to just to try to give a nice improvement without too much, or without going for 100%. Now, starting in the lower face, taking a look, she has a very nice jawline. So she has no post-auricular sulcus, nothing to inject there. In the lower, along the jawline, again, even though I want to improve the oral commissure, thank you, I will start lower down. And where to start? The injection is on the bone. It will be at the point, what you can do is just this little exercise to see where there's that crease on the bone, and slow lift and inject. And we could see how that's filling up. And the reason I start at the base is to give support. So that is different than what we said before about starting up and moving down. This is the exception. And you could already see how that's the difference, is that you don't have that crease that we had before. And another one here. It's much nicer. Now we're going to use some of the Volbella and to try to address the corner of the mouth. This is again important as this does portray someone who is a little sad. And what we're going to do is try to get into the corner. And the idea here is to be, I'd say, superficial and small amounts. And you see how it's just flowing. Okay. And already it has gone up. And I'm going to swing around to the other side because in this area you want to, okay, gotcha, not a good one. Okay, that's okay. So, okay, now we're going to be going a little lateral. And gentle. Okay. Okay. And back here, and we'll just spread and superficial. And okay. Can you open the mouth? Alrighty. Just a gentle massage. Okay, beautiful. Alrighty. So, what I'd like to just to take a few minutes just to review what we have done. We've attempted to lift the left brow to make it closer to the right one. There may be other things that can be done at a later time to improve this. It's possible to even put some material up in the lateral forehead to lift, or again, there may be other ways. We addressed the glabella complex, at least part of it, and again, a superficial, very bleb injection over the lateral corrugator. Moving down, we addressed the earlobe. And again, that is done. Okay, sure. Okay. Yes, okay. And again, what all this does is take care of this little convexity, nicer, it treats this concavity, makes it into convexity, and you have a nicer reflection of light. We also put some in the material, some voluma in the lateral zygoma, in the point of maximal reflection, in the malar, a bit in the tear trough, and you could see the difference. Moving down into the jawline, and also the corner of the mouth. Maybe what we could do is just clean this side while I just take any questions. Okay, thank you very much. No, okay, let's say. Are there any questions, points, comments? Yes? I'm the Volbella. Volbella, yeah. For the ear also Volbella. Yeah.
It's the indication, one of the indication of Volbella here.
Is it an indication?
Is it on label to use Volbella in the ears?
Well, the indication, On the, well, this is on the ears, so it's not on the face. Huh? Yes, yes it is. Okay. Okay. Okay.
Yeah, that's okay.
Okay.
There's one thing I'd like to
Yes.
Why did you choose the Volbella for the eyebrow?
It can, I could have used Juvederm 3, possibly 4, also. I really, I find, I'll tell you, I'm in love with the Vycross products. And as good as Juvederm products are, I just like the Vycross products. So that's really why I used it. I could have probably gotten away with some Voluma in this area and maybe even gotten more of a lift. But I just enjoy the Vycross. I enjoy the way it molds and the longevity and the smoothness. And this is a sensitive area, the brow, because if there is too much of an anterior projection, they get this Neanderthal look that is not that becoming. So a little less is more, and I think especially in a woman's brow where I just want to try to give it a little boost without giving it a bit too much, so that's why. Yeah, please.
But comment. It seems that your first 10 minutes was the best, and then you have had a maybe not so loud voice. And my impression that first 10 minutes you was energetic, then next 10 minutes less. So it's my suggestions. Probably maybe try to do the same level.
Okay.
Try to do the same in 10 minutes.
Try to do the same. Okay.
But
So, okay.
Nerdy?